Okay, let's start the class. Okay, let's start. Okay, so today we had anatomy or the palate, and so let's start dental anatomy. We already discussed definition of the primary teeth or deciduous teeth or milk teeth or baby teeth, the same name, and then secondary teeth are the permanent. And then a tooth is made of three elements: water, which we can't see, but everything is made up of water, organic materials, and inorganic materials. And then there were primary teeth, deciduous teeth, milk teeth, baby teeth. I'm repeating, so you know they are the same name. They started from the 6 month. They start eruption. Eruption means when they come out of their alveolar bones, they come out of their jaws, right outside, and they appear is known as eruption. Eruption of the teeth is a process, a painful process. Baby cries. So they start at 6 months, and from the central incisors, lower central incisors at 6 months, and the child complete, most of the child complete their primary dentition at the age of 3 years. Then they use it for further 3 years up to the age of 6, where permanent teeth start erupting, and most of the permanent teeth are there in the 6 years, which is double of the eruption time. So at 6 they start, and double them, and 12 they almost complete the permanent set of teeth. Eruption is complete. And the third molar is exception, because medical science exception, and that comes at the early 20s or teenage, late teenage. Then we saw it another way and compared them, primary and secondary. And here we started knowing the types of teeth with the color coding so that we can remember. One thing was important here, which was only this, that central incisors and first molar come together, because we not only cut or tear the food, we also need to grind it. So at least we should have some molar. We should have some molar, come on, right? Some molar. So this first molar comes with the central incisors. So identifying teeth, the types of teeth: incisors with central or lateral, canines, cusps, premolars, bicuspids, and molars straight across, and then wisdom teeth and the end. Let's start with their description. Excuse me. Incisors function as cutting or shearing instruments, tools for foods. So incisors, where are you, where are you, where are you, where are you? Here. So you are flat here, right? And you have a sharp knife-like incision, cutting. Oh, knife cuts, it has sharp ending. Okay, cuts. The function as cutting, same thing, shearing, tool for food. So it cuts because it is flat and looks like knife. Okay. Works to bring food into the mouth and don't let it exit, because if you don't have incisors, food can exit. Okay, works to bring food into the mouth and cut it. Okay, we understand that. Canines, it also cuts and tear up food, but mostly tears. Canines possesses the longest roots. I see. Previous showed better view. They have the longest root. You know, you see X going all the way to the name. Longest root of all teeth, and are located at the corners of dental arch. Okay, so dental arch, the corners are made up of this is an arch. This has two arcs. This is the straight, almost straight edge of the arch. This is a corner where it bends. So they are saying it corner. So these are the cuspids or canines. Located at the corners of dental arch, function as tearing of food. Okay, cutting, knife-like cutting, giving an incision. You know incision? You give a blade, you have a blade, you have a knife, surgical knife, you give incision. That's why they cut. Okay, canines, they tear it, they tear. Canines, that's why, you know, those cats and tigers, those in the scientific name, they have canine, felis, and this and that, right? The name of cat, and they have felis or canines because their canines are long. If you have seen the movie that Ice Age, there was an old tiger, his canines are out of his mouth, right? Even if he's laughing, canines are not laughing, because they are not for laughing, they are for tearing the food. Yeah. And then we have premolars and molars for grinding the food. But premolars are not like molars because they also act like canines in tearing, but they have molars activity like grinding like molars. Premolars are before molars and they act like canines in tearing the food and act like molars in grinding the food. Premolars act like canines in tearing the food and are similar to molars in grinding of food. Where are you, premolars? Here are you, premo. Okay. Help incisors and canines grind and mix food while chewing. You are telling us extra thing. It's also mixed food. Okay. So molars, they are the okay, so miserable. Teeth that do the most chewing work while eating. Oh, you make our food delicious. You know, you mix it with saliva. You also mix it. Okay, I'm not saying only that guy. Okay, so you also mix the food with saliva and you grind it. Okay, molars, because your surface area is big, so your grinding surface area is big. Okay, molars are located nearest the temporomandibular joint. So these are first molar, second molar, and third molar is wisdom teeth. They are located towards the joint. I'm taking a lot of time so that you can digest more information and more of these terms. I'm taking time so that you can digest and remember more of the terms. So incisors, canines, premolars, and molars were located nearest the temporomandibular joint (TMJ), which serves as a fulcrum during friction functions in the grinding of food. Now let's go to the tooth surface. So we have surfaces of teeth: apical surface, labial surface. Labia is lip, right? And lingual is glossus, lingual, oh, tongue. And then there is distal surface, and then there is mesial surface towards the midline of the two. Okay, and incisal surface. Okay, let's see here. Facial surface, frontal surface of the anterior surface is facial surface. So behind that, these surfaces. Okay, so let's mark them. So if we come from here, we will see the facial surface of the tooth and teeth. If we come from inside to outside, we will see the lingual surface, because this surface is toward the tongue. This is surface is towards the tongue, so lingual surface. Okay, and then distal surface and mesial surface, and occlusal surface is the surface used for grinding. Occlusal surface is the surface used for grinding, but this facial is labial and this facial is buccal. Why? Because labial means lip and this surface is in front of the lip, so that's why labial surface. And there is buccal surface because here we have buccinator or buccal cavity or cheek, which in medical terminology is known as buccal. Okay, perfect. Now we have some idea. Maybe we have some more pictures. Oh, we have some more pictures. Okay. Apical surface pertaining to the apex or root of the tooth. So is inside. The root is towards here. So the root is apex. It pertains towards the apex or the root of tooth, and that is apical surface. So we have apical surface, which is in the socket of the teeth. Okay, sure. Then we have labial surface. As you know, labia is lip. So towards the lip, if we come from outside, from the lip side, if they smile and their lips get apart, we'll see their teeth. This surface will be this surface towards from the lip side will be known as labial, and towards the tongue side will be known as lingual, and towards the buccal cavity will be known as buccal surface. Okay, sure. That's how you name it. Easy, not me. Come on. So labial surface pertaining to the lip describes the front surface. Okay, so can we go up to here and we use the mouth and draw at the same time? Wow. Okay, I learned new thing. So labial surface pertain to the lip. Labia describe the front surface of the anterior teeth. The front surface of the anterior teeth are the labial surface. Okay. And then lingual surface towards the lingua, towards the tongue, towards the glossus pertain to the tongue, describes the back or interior surface of the teeth. And then there is distal surface, the surface of the tooth that is away from the midline. So this is midline. away from the midline is this. So this is distal and this is mesial because it's towards the midline. M is midline. Oh, like that. Oh, I see. So it's easy. So why you don't name them medial? Why you name them mesial? Because you want to make us confused and you want to make us learn extra thing. Okay, no problem. So now we have learned mesial, M, and median. So towards the midline, the surface of the teeth towards the midline is mesial or median or mesial, better mesial because it's tooth, because they say so, and away from the midline is distal. Is easy. You are not confusing us. Mesial. Okay, so incisal or incisal surface pertaining to the tip or cutting. So apex is basically known as tip, but you say or root, so you are confusing us. But we know that the root is the apex because it's the pointing type. Apex does not always mean tips because it means the pointing type, so it goes inside. So here apex is not tip, so apex is the root of the tip, and incisal surface which cuts this surface cuts, this area cuts, so that is incisal surface because it helps in cutting, grinding of teeth. But for grinding, we have premolars and molars. For grinding, we have premolars and molars, and that surface which is helping grinding is occlusal surface, which is not here. Haha, you know more than slide. Okay. So apical surface, labial surface, lingual surface, distal surface, mesial surface, incisional surface, occlusal surface, not seen here. So where have we studied that? Oh, here you are. You see, we learned extra. There is occlusal surface. Come on. Oh, so this was occlusal surface. Yeah. Can I draw? Please let me draw occlusal surface. Okay. Now we know an extra surface. Big deal. Okay, let's go to the next. If you already know terms in dental practice: outer surface of teeth, labial surface we know towards the lip, buccal surface we know towards the lateral side of the teeth, towards the buccal cavity or that buccinator muscle. We know lingual surface inside the nearest the tongue. We know inside towards the lingua there is tongue, and then that's why there is a lingual surface. We understand that. Tell us something new. Come on, tell us something new. This slide is making fun of me. So tell us something new if there is lingual surface. Okay, and mesial surface, you know, you are mesial, you know, you are median. Towards the median, the tooth surface, which is towards the midline, and away from the midline, will be distal. So if we talk about this teeth, if we talk about this teeth, right? Let's talk about this one. This one is what? This is incisor, because these two and these two are incisors. Then this is what? Canine. Oh, sir, you made a mistake. It's canine because it's making the border. Remember? Oh, I remember. So incisors, right? So if we talk about this incisor, which is making the two corners of the arch, yeah, this one and this one. So this is, if this is the midline, so this one, this surface which is towards the midline will be mesial surface, and away from the midline, more laterally, will be the distal surface. Ah, you said correct, sir. I'll give you some. We'll give you a chance. Go on. Distal surface, short side of the tooth, farthest from the midline of the jawline. Okay, no problem. Let's move to the part of the tooth because it's easy, not because we have time, because it's easy. The three parts of the tooth or teeth are crown. What are you doing? Okay, crown, root, and pulp chamber. Why anatomic crown? Why anatomic root? Because this is anatomy. We are studying anatomy. Okay, so anatomic crown. Then there is root, which cannot be seen, which is inside because it cannot be seen. That's why it's root, and which we can see outside the crown of the teeth. So eruption of the teeth is a process of crowning of the teeth, also sometimes itself known as crowning of the teeth. So the eruption is crowning of the teeth. Then the crown becomes visible up to the mark. Okay, so here is the bone, alveolar part of the mandible or maxilla, depending on which jaw is here. And then we have enamel. Let's start with this these terms: enamel, dentin, pulp. Oh, this pulp is this guy, pulp chamber. So 3 parts of the tooth. The broad terms used for this is there is crown, which has enamel and dentin. Then there is root, which has root canal, periodontal ligaments, mentum, gum is outside, and then there is pulp chamber. This is pulp. This is pulp. This. Yeah. Which contains all the pulp, all the juicy nerves and arteries and veins. This is pulp. Okay, no problem. Parts of tooth. 3 parts of a tooth: anatomic crown, anatomic root, pulp chamber. Anatomic crown is the portion of the tooth covered by enamel, can be seen, visible. Anatomic root is the lower 2/3 of the tooth. Pulp chamber houses the dental pulp. So we have a pulp. This houses the dental pulp, and which is an organ of myelinated and unmyelinated nerves, arteries, veins, lymph channels, connective tissue cells, I'm tired, and various other cells. Okay. So outside covering can be seen crown. Inside 2/3 of the teeth, which cannot be seen, root. We need a strong root, otherwise our teeth are gonna crown out, drop. And then there is a chamber, there's a house, which is known as dental pulp, because it's a teeth, that's why it's dental, and it's pulpy, it's pulp. And then it's a house for organs of myelinated and unmyelinated nerves, arteries, veins, lymph channels, connective tissue, and various other cells. Okay, we have some idea. We can move. Dental tissues. I think this guy is blocking us. Okay, we can go here. Okay, so dental tissues. Now we have dental tissues. So what are the dental tissues? Come on, don't do this. Dental tissues: enamel, dentin, we have heard last slide. Odontoblast layer, odontoblast, osteum. Okay, odo means teeth, blast immature layer. So we have a layer of teeth cells which are blasts. Okay, sure, outer side. Okay, no problem. Next to dent. Okay, so pulp chamber. Then we have a pulp chamber. It should be soft, pulpy. Gingiva or gingiva, periodontal ligament, cementum, alveolar bone, pulp canals, and apical foramen. So let's again enamel, dentin. Enamel and dentin looks hard, you know, they are dental, they are outermost, they should be hard tissue. Other than that, cementum is like cement, you know, if he's not hard, is a fun of his name. So cementum is hard, and bone is definitely hard. So we have 4 hard tissues: enamel, dentin, cementum, alveolar bone. We remember now. And we have a soft tissue: pulp chamber, gingiva, or these gums should be soft. And then we have periodontal ligament, which is soft. Okay. Other than that, we have a odontoblast layer of cells. We have a pulp canal. And then what is pulp? So if this is pulp and then this is pulp canal or root canal, oh, I see. So this is pulp chamber. This is the whole pulp, the pinkish one where these arteries and veins, and this is the pulp chamber, and these are the canal, also known as root canal. Sure. And then alveolar bone, where this is the bone, this is alveolar bone, and pulp canal and apical foramen. So this is pre-apical tissue. So now we go for the enamel, outermost, then dentin. Next, these both are hard, and then there is odontoblast layer in the pulp chamber outer side. Maybe we cannot see it here. And then this is pulp chamber and root canal. And then this outside is gum or gingiva. And then cementum is here. Cement, this teeth, in between this teeth and this periodontal ligament, there is some cement known as cementum. And these are blood vessels. And then there is jawbone and root apex. Okay, apex is not the tip. Tip is this. Apex is this. This is incisional surface for grinding or occlusal surface for molar. This is apex, root apex. Here the apex is root in the case of teeth. This is inside. Sure, You'll remember that confuses more. So this is a cross section of a tooth. Again, enamel, dentin, pulp, gum, gingiva, root canal, bone, and cementum. And then we have 4 types: incisors, central and lateral, canines at the bone, at the borders of arch, bony arch. And then we have premolars and molars. Molars go here, okay? Premolars come first. And then again, dental tissue, another view up to here, the root and opening. Then all of the nerves, arteries, veins going here. The cementum is in between the gum and the dentin part. Inside is pulp, outside is dentin, and then there is enamel. Enamel gets yellow. Hassan Ali, what happened? Okay. Next, dental tissues. There are 4 main dental tissues: enamel, dentin, cementum, and dental pulp. These 3, enamel, dentin, and cementum, are hard tissues, whereas dental pulp is the only soft tissue in the main dental tissues we are talking about. So here, okay, the anatomy of the tooth, 95% minerals, and because there is calcium and phosphorus, that's why it looks white, and they which bond together to form hard crystallites. 95% mineralization of this teeth. We don't have 95% because I think we have decay. 4% water because our teeth are demineralized. We drink Pepsi every day, cola, and then 1% protein. Okay, and then this enamel, another view: enamel, dentin, pulp, and blood vessel and nerves, crown, neck, root. Neck we have not heard, we just say crown, and root. If we know, it's okay. 99% inorganic substances. By comparison, bones are typically around 70% inorganic substances. So in comparison to bones, teeth have 99%, whereas usually other bones of the body have 70% of inorganic material. So they have more calcium and phosphorus. So why don't parathyroid hormones ask calcium from here? Why our bones? Come on, this parathyroid gland. Okay, so first we will start with enamel. Oh, okay. Before going to enamel, dentin, I think we should have a review of class. Let's review quickly. Okay, let's review this class only. Has enabled closed captioning. Can you see the transcript recording on? Okay. So today we have dental anatomy. We have read about primary and secondary dentition, water, organic material, and inorganic material, because our time is less. And then there is primary teeth, decidual, secondary teeth, permanent, and then there's a comparison and identifying teeth. Let's identify teeth. If anyone has a question regarding to today's topic, please ask now. Now is the time, while I'm asking questions. So we studied palate, anatomy of palate, nerve supply, muscles. We try to remember those, and now the teeth. So let's go to the Junaid. Junaid,
Yes,
can
sir.
you tell me the mesial and the distal surface?
Yes, sir. The mesial surface is more near to the midline, and which surface, sir?
Distal.
And distal surface is away from the midline, means lateral side.
Okay, perfect. And then so let's just almost finish the class. The time is here, 3:45. If you have any question regarding to upcoming or this topic, you just let me know now. Otherwise, I'll see you on Monday, next Monday. Please try to revise your lecture with the time so that you don't have to worry in the end. Okay, take care. I'm gonna stop sharing if you don't have any question.
Thank you, sir.
Okay, thank you.